Now, Medical Director of the Upper West Regional Hospital, Dr. Robert Amesia, says the lack of continuous supply of food to patients at the hospital is impeding quality healthcare delivery. He notes that though government through the medical stores has been providing food to take care of the patients, the facility sometimes runs out of supplies due to the overwhelming number of people that visit the facility. The hospital, which started operations 14 months ago, is yet to receive seed fund from government and is also affected by the erratic reimbursement of claims from the National Health Insurance Authority. Dr. Robert Amesia spoke when road construction firm Usuya Ghana Limited donated 100 bags of maize to the hospital to take care of the feeding challenges at the facility. A report now by Rafiq Salam.
Amongst the myriad of challenges faced by the Upper West Regional Hospital since it started operations 14 months ago is feeding its patients. Mind you, the hospital started without seed fund from central government, and therefore procuring certain valuable items to the hospital sometimes becomes a nightmare for authorities at the facility. The case further worsened and stretched to its elastic limit during the advent of the COVID-19 pandemic, where the facility was used as a holding and treatment center for persons infected with the deadly virus. Medical Director of the Upper West Regional Hospital, Dr. Robert Amesia, speaking at a short ceremony where a reputable road construction firm, Usuya Ghana Limited, donated 100 bags of maize valued at a little over 15,000 Ghana cedis, noted that though they have received from government through the medical stores food items, it has not been enough due to the sea of people they attend to at the facility.
For food, it's something that is continuously being used. If you eat today, you eat tomorrow. So even though we have variously received items from central government through our medical stores, but because they are being used every day, you run out not because it hasn't come, but you run out because it is continuously being used. We know we are not the only part of Ghana that COVID patients or other patients are taken care of. And of course, because everywhere has to be taken care of, the supplies might not be enough at all times.
He therefore sees the donation of the 100 bags of maize as a welcome news and egged other benevolent organizations and individuals to follow the example and come to the aid of the hospital.
So this has come at the right time. So what I can say is that we will use this, and 100 bags will take us some time before we start going down, below our stock. So we are very happy. I wish he was here personally, but I know one day he's so busy a person, but we owe him a lot of gratitude because we know people who are equally capable like him. And he has not given to us only once, he hasn't given to us only twice, but more than 3 times. And I think that he has a special spot in his heart for healthcare delivery. And then we pray for him for long life, prosperity, so that he will continue to be kind to mankind.
The company last year donated personal protective equipment, hand sanitizers, face masks and shields, thermometer guns and tons of gallons of liquid soap to the region, valued at 270,000 Ghana cedis. The donation makes the road construction firm the biggest donor of COVID-19 equipment to the region apart from government. Representing Usuya Ghana Limited for the donation is Rafiq Salam.
But somewhere along the line last year, he decided to diversify by going into farming, and who took him to the Dafema Buri Isa district, where several hundreds of acreage of maize were cultivated there. And so we are in the month of Ramadan, also month of sharing. And so he deemed it also as part of the social corporate responsibility to also donate some items to some institutions and some individuals.
The company later donated 50 bags of maize each to the Upper West Regional Chief Imam and the Upper West Zonal Mission of the Ahmadiyya Muslim Mission. They also donated several hundreds of maize to other identifiable vulnerable groups in the region to help cushion them in this period of Ramadan. Rafiq Salams reports for Joy News.